Hello, everyone. This is Walker Bragman. I'm here with Ahmed Baider, who is a journalist producer in Yemen, in Sana'a right now. Mr. Baider, thank you so much for taking the time and speaking with me. I really appreciate it.
My pleasure. Hi.
So, my first question for you is, are you safe right now, and is your family safe?
Well, my friend, I know Yemen, it has been at a war since 5 years now, and the situation is very bad. And, you know, of course, there is always in a war, there is a bright leave in a good life, but we really feel we really feel that we are in danger. Actually, it's not because of the war in the worst humanitarian crisis in the world, but it's also because of COVID-19, which is what we can say is the new and invisible enemy that we all of the world is facing. So let's say I feel safe to be with my family and COVID-19 not to be anywhere in the world where everything is blocked and closed. But I don't feel safe in a country that is under a blockade and war since 5 years.
I, I can't imagine, and I don't think that many people in the United States can imagine that. For a little context, Yemen has been in horrible conflict since 2015. And in that time, Saudi Arabia has established a blockade of the country, the medical supply, cutting off medical supplies and food. The medical infrastructure in the country has been decimated by the fighting, and so it has been called the world's worst humanitarian crisis. It is a very dire situation, and obviously, COVID is ripping through even industrialized countries. Um, and Yemen has gone through, I think, a rapid uh, I, destruction period of destruction. So I am glad to hear that you feel that you're with your family and that everybody is healthy right now. But my heart goes out to you. Um, what are you seeing on the ground in terms of people taking precautions and um, uh, whatnot?
The problem is, my friend Walker, that the Yemen people are aware about this dangerous virus. They think it's an illness, and the problem is the economy in the country. And a country that suffered from a war since 5 years now, it has, of course, it has a fragile health system. It's not a place that you can face a new enemy as COVID-19 is coming to the world. So COVID-19 destroyed the big infrastructures, health infrastructures in the world. How it would be in Yemen. In Yemen, we suffer from malnutrition. We suffer from different illnesses such as malaria, cholera, and you know, al-mukarfas, they say its medical name is anemia, and also different kind of illnesses. The problem is how we can cope with the situation. We are under a war, and there are different powers who control the country today. You have people in the north, you have people in the south fighting. It's a little bit complicated and complex. And civilians, us, what we really need, talking in behalf of civilians, they need their basic needs. You can't imagine. Can you imagine a country with electricity since 5 years now, without water, without salaries for the government employees 3 years now? So just teach in schools without salaries, doctors treat patients without salaries. So imagine how people can, how they can get their money to live, how they can manage living. So imagine, and missiles from the sky, and then you have corona and cholera diseases from the ground. It's a really bad situation. And what we really need is a real peace deal that the international world should support. that many people should come back to the table to do an agreement that we can, that Yemeni people can build their future together. Stop fighting. We believe that the war in Yemen, it will not be resolved by army or fighting. So we have to stop fighting. We have to decide that, okay, we should build our country, and we have to help people. There are thousands of people who lost their home because of different measures. At the same time, there are people who try to find their food, their daily life food. There are people who try to feed their children. I met women while I'm doing my work with foreign media. I travel all around the country, and we go and talk to the people, to the citizens. One time we asked a woman, and we asked her, if you have two children, one is sick with malnutrition and one is sick and who needs medicine, who would you offer? She said, of course, I will offer it to the sick who needs the medicine. And malnutrition is like, it's like food. If they have food, they will die. There are hundreds of Yemeni children who die from hunger. I mean, you can't believe it. How is the situation here in Yemen? I'm not talking about me or about the people who lives in this. We believe are in conditions. I'm talking to the people who, in behalf of the people who are in villages, who doesn't afford money to buy basic needs. So we we should we should do a peace agreement with Yemenis themselves. They have to sit in the table, and they have to talk to the neighboring countries, and we should say to this, stop. As we said, it's the worst humanitarian crisis in the world, and it's by man. It's not like a humanitarian crisis that comes from nature. People who created. So I mean, it's horrible. I mean, people are suffering, and what really scares us today, COVID-19, because people are not aware about this dangerous virus, and this will kill a lot of Yemenis. Hopefully not. Until now the statistics are not high in Yemen, but it's high and high because we don't have that good system that we can record the number of cases.
Yeah, I was going to say Yemen right now is reporting very low case numbers, but that is absolutely the numbers that they're reporting are
Possible, yeah,
absolutely wrong. There's no
absolutely.
way they are correct. In fact, we've seen this before in the death toll. That number of people killed in the combat was stagnant at 87,000 for months, despite constant barrages of Saudi war jets and coalition war jets bombing the hell out of Yemen. And so I did want to ask, are you, what do you think? Have you heard anything in terms of a more accurate estimate than what we're officially getting in the press?
Of course, 100%. The statistics, the real statistic would be much more higher, because you have, people are in villages, a faraway place, people who will decide to stay at home, not to go to the hospital. I mean, there are people who are not well educated. If you are sick, you have to cope with it inside your house, with that traditional medicine. And there are people who die in their way to the hospitals, and there are people who goes to hospitals. For example, I know stories that people who goes to a hospital in Aden to coronavirus hospital, and when they arrived they said, oh, sorry, we don't have enough beds. Imagine they have only 12 ventilators in Aden hospital. 12 ventilators. And like I read in one of the articles, they said there are like people, they for example, if there is a sick people goes to a hospital, they wait for someone to die so he can replace his bed. What's in the US or UK, they have their health good health systems, and they really suffer a lot. Imagine in Yemen, people who doesn't have ventilators, who doesn't have medicine, who have blockade from entering masks and such important things to protect yourself from COVID-19. So it's a really big problem. If we have we can, if there is lessons from other countries shows that containing the spread of virus relies on four factors. First of all, medical capacity, supply capacity, movement control capacity, and information management, which is mainly my specialty, being a media producer and journalist. Because you have to have media in this to support, to teach them, to raise awareness about how to wear, how important to have this to protect yourself from this virus, how you deal. So everyone try to do their best, and what we really need is peace. This is the time for peace. If you go to any civilian inside Yemen today, you do a Vox interview, anyone will say, we had enough from this war, we really need peace. And that's it, finish.
It's a terrible, it's a tragedy, and it's one that there doesn't seem to be an easy way out of, because of all the foreign influence that is sort of turned Yemen into a chessboard for
Yes,
international powers that are vying for
unfortunately.
influence in the region because
Absolutely.
Yemen is strategically located. So I wanted to ask about the fighting. Um, when we spoke over WhatsApp, you mentioned that around you the fighting has slowed, not completely, but it has slowed. But in other places it
Yes.
hasn't. Um, how can they still be fighting a war in the middle of a pandemic?
Unbelievable, unbelievable. Believe it or not, that there, after the United Nations, asked the fighting powers to announce a ceasefire because to fight the corona pandemic. And we were very happy, and we know always we have ceasefire, but if you come to the real life, there is no ceasefire in the ground. There are people who are still fighting. There are people, there are front lines which will be more active sometimes, and it's a matter of, the priority is human. It's Yemeni people who dies every day, who really suffer every day. You know, it's not about the people who just got a bomb inside their house, but also the majority of people who doesn't have salaries. Who, for example, I know so many teachers and they don't have their salaries. What should they do? Should they go and teach in schools? Should they go? How is the doctor who will rescue his or her life to treat coronavirus patients and he doesn't have salary? This doesn't make sense, and this is this is a really a big war crime. I mean, if United Nations help us, all of the world help us with medicine or with support or with money, whatever, it can not help Yemenis than to stop the war, and to make, like, we need a pressure from the international community. We need from the US, we need from UK, from France, from the Security Council, to make a big decision that Yemeni people can get benefit from. It's not like, fighting, and you just ask for peace talks, and then you never show up for peace talks, and then they fight each other. They have to do an agreement, and they should decide. The international world should say stop for this big chaos.
How many hospitals are functioning in Yemen currently?
Well, as you say, if you saw the UN report, it says like half of the medical uh, hospitals and centers are not working, because of the war circumstances. But there are, like, I can say, the active hospitals that treat COVID-19 patients now are two in Aden and two in Sana'a. That's it.
Four. We're talking about four.
Four, I mean, who are specialized COVID-19. There are other, I mean, hospitals, but they are not treating COVID-19. And there are isolation centers. They have different isolation centers in different governorate, but they are not hospitals. Uh, And what can we do? We try our best. We try to share the story. I try to raise the awareness of Yemen war to the foreign media, to international, so people can know what's going on inside the country. Otherwise, as they always say, Yemen is the forgotten war that all world about it.
I talked to somebody within the Ansar Allah government, and they told me that they only have about 2,000 test kits, and this was back in April. They only have about 2,000 test kits for COVID and about 400 ventilators. Um, do
And
you?
on the whole country.
That's the whole country.
Yeah,
So
it's not.
that's
It's not that. I think we have 400 ventilators for the country, not the northern region, which is controlled by Ansar Allah only.
so not just so that's everywhere. That's including.
Yeah, yes. I mean, it's horrible. I mean, imagine if there will be a new wave of cholera or something in addition to corona. I mean, it's corona kills the people with chronic diseases, with the people who doesn't have strong immunity. So imagine most of the Yemenis that don't have strong immunity. So yeah, well, that's
It's so there's something, and there's more to it as well. There's the danger that it takes for doctors to even to travel.
yes,
In a war zone, doctors traveling to treat patients risk their lives out in the open. Um, how have you been? I mean, you've obviously been traveling around Yemen.
yes.
How
Well,
have you been just living with the risk that you incur to draw attention to this conflict?
Well, we have a very big risk, when we cover I won an Emmy last September for my work with PBS News, and the category was the hard news coverage. So when you say the hard news coverage, it means it's the hard news coverage in the world. So when journalists come to Yemen, they have a very, very big difficulties. Us, when we coordinate for them in the ground, we need to prepare their papers. We need to talk to different powers, and it takes a long, long process to bring into the country. So after that, then you have the risk traveling inside the country. You go from this power to this power, you go to this place and that. I really feel safe being with Yemenis. I mean, my people, when I'm inside a village or something, or a rural area or something, I feel fine. I mean, it's us, but you never know. It's a war. Everything is not expected. So you might have a shelling, or you might have it's a very difficult thing, and we really face so many risks. But we try as much as we can before we go to any place. I mean, when I work with foreign media, we try to do risk assessment, but you never know. It's war, and nothing is expected. But yeah,
Yeah, that's a constant theme that I've been hearing when I talk to journalists who are working in Yemen. That it's that there's just a certain amount of risk that goes with the job, and but in the end, ultimately the commitment is to the people and getting and spreading the news of the war for the benefit of the people, so that the world can see
yes.
and react and help and maybe stop the fighting. What would you say, as somebody in Yemen? What would you say to President Trump?
Well, we really need the support from America as they're a big international power, that they have to do pressures into all of the powers fighting inside the country. They have to stop this war. We have to stop thinking about our interests as the US selling weapons to different countries or anything, or this such of concept. We have to say Yemeni people, more than 28 millions of Yemeni people die every day. they have to, give pressures. Will say they have to give a peace treaty, or they, have to do something. And as they are one of the main Security Council, partners there, and they have to, they have to push it, and they should decide, and they have to keep their own interests aside, and they have to think about humans and people lives and innocent lives. People daily die, people are suffering, and people are, and are very upset. So they deserve to leave. So why don't they, the US or Mr. Trump push for the Yemeni peace? If he is looking for success, he should, do something in Yemen before he finishes time in October.
So, as somebody who works with international press organizations, what would you say are some of the biggest difficulties you have in getting your work out there, getting the message out there?
Okay. So working as a field producer with intermedia in Yemen is very important, so we can share the story from the ground. The difficulties that we face is sometimes to get, all of the procedures or the visas from different sides of the country, from the south, from the north, and the blockade. You can't enter the Yemen, and if you want to go to Sana'a, you need to travel through Aden, and then you from Aden you drive 12 hours to Sana'a. The story is very difficult in Yemen, and some have difficulties from this because they don't believe in how this will send their story, and that's issue. People are. I have a lot of friends who are keen to the war in Yemen, but they can't. And at the same time, it should be easier for journalists to come. In the same time, journalists should be more interested to, to cover the war in Yemen. And so it's really, it's a little bit difficult. I say it's a hard news in the world.
And how old are you, if you don't mind by asking?
Yeah, of course. I born in 1990, so I'm 27.
You're 27 years old.
Yes, yes,
I am older than
yes.
you. I am older than you,
I work.
and you have
I used to work. I worked in this since I was 18, so I have a very big experience in working with analysts, and look,
I
yeah.
just
So we do our best.
you've seen so I mean obviously you've seen so much. Uh, how do you cope with the horrors that you have seen in the course of your reporting and your work?
It's terrible, it's stressful. Sometimes when I work for the TV and then I watch other TV, I keep seeing, that kind of malnutrition case dying, and horrific photos. But what we can do is like we try our best. What really make me satisfied that I'm sending the story from the country, from my country world, to know what's going on in the country, and we try to do our best, and I think I'm in a better most of the Yemenis that I really feel upset to see them.
Well, Mr. Baider, I do appreciate you taking the time out of your schedule to talk with me. Um,
My pleasure.
I
Anytime.
my thoughts are with you and your family, and I really please stay safe, take precautions if you whatever you can do, and best of luck to you. I hope that we can do another one of these under happier circumstances.
Oh, thank you. Thank you so much for raising, for sharing information from Yemen. People in America, they should know what's going on in the country. We are working with several reports about COVID-19 that it will be published in America the coming weeks. We need to raise the awareness. You will say, I would love the Americans to be more with Yemeni people because we're all humans and we feel each other about each other. And we just want to say that, like, if I my end word is that Yemeni people from all around the country need to put their problems and differences aside, focuses their efforts in fighting the virus that threatening all Yemeni people, regardless of anyone's affiliation. And as we can say, it's we should fight, all of us, the one only common enemy that's called COVID-19. Our thoughts also with the US today about what's happening, and also what's happening in about in the now we can say the COVID-19 crisis in the US. There are so many innocent people who dies every day. Imagine, if this is in the US, how it would be in Yemen. We need to protect ourselves. We need to be, we need to live in a peaceful world that we can, go from country to country and, live in peace.